All right, welcome back to the channel. My name is Dan Zatarski, pharmacist and owner here at MD Custom RX in Brookfield, Wisconsin. Tonight we'll be discussing vitamin D and its importance in the immune system and also other benefits as well. So, long story short, we've got vitamin D at a 50,000 unit strength. We'll get into that. My favorite product is K-Force. I've been taking that personally myself for 3-4 years now. It's got 5,000 IUs of D3 and 180 micrograms of K2. And that's important. We'll talk about that further on in the seminar tonight. It also comes in a liquid drop. This is again by Orthomolecular. Hopefully you can see that at home. It has 1,000 units of D3 and 10 micrograms of vitamin K2. It is important regardless of what product that you're taking for vitamin D. I strongly encourage you to talk to your doctor or provider about D3 with the addition of K2. Pricing on these products, we've got around $20 for the D3 50,000 IUs, and that's a 15 pack box. The K-Force here sells for $41 for 60 capsules. And then the liquid drops, which has right around, depending on your dose, 500 to 600 servings. We'll get into that as well for $30. So that is a nice option as well too. You do have to be careful with vitamin D3. You can get hypercalcemia, which is too much calcium in the blood. One of the classic signs for that is actually you itch. You have itchy skin essentially. So before starting any type of vitamin D, you want to make sure that you do, again, consult with your provider, with your physician on that. The pharmacy is open Monday through Friday, 9:30 till 6. Our phone number is 262-373-1050. I encourage you to call the pharmacy, call the front desk. Kelly and Crystal are there every day. If you want to schedule an appointment with me, I encourage you to do so. The cost for that is $100. But enough on that. Let's get into the seminar, and I hope you enjoy the presentation. Thank you much. So yeah, I've got about a half an hour, maybe 45 minutes, and we're going to talk about vitamin D, and then we'll take a little pause. Those that want to bug out, that's fine. What I did add to the end of this, then I've got maybe another 10-15 slides. I did a talk back in March that was strictly just YouTube. I don't even think we had anyone that came into the store. I just basically talked to the camera for about 20 minutes on different supplements just to improve the immune system. But tonight's main focus is strictly just going to be on vitamin D and why is that one single nutrient so critical to inhibiting this virus from spreading, essentially. Or well, I should even say from that point, but also taking vitamin D. If you have any type of influenza virus, your chances of success are much, much greater. So that's my goal tonight, is to prove that to you all. So obviously this is where we're at. I was going to show people on YouTube that we actually physically exist. You can come into our store and meet me. I'm a real person. I was going to go through all, this little autobiography on what I've been up to, but I'll skip that. My medical disclaimer. So anyone can really start vitamin D. It's very safe to take. Hopefully I'll prove that tonight too. But you still want to just check with your doctor, of course. If you're I'm going to be recommending extremely high doses tonight, way above the recommended daily allowance. So I'll talk about that, and then why that number is really outdated. It should really be updated, especially after the last 12 months of data that we've got. So the bottom line up front, if your vitamin D level is where it should be, which I'll get to in just a minute, it's really not that scary. So hopefully I'll prove that to you as well. COVID viruses have been around since 2002. This is really nothing new other than it's a different strain. Yes, is it more deadly? Yes, those still numbers are coming out. Some people are going to debate that forever. But if we look at it just from a mechanistic point of view, this is a virus that's just from a different breed. Vitamin D reduces the risk of upper respiratory infections. So that's one thing we know right off the bat. That's been proven a long time ago. So any type of upper respiratory tract infection, if you have an elevated, again I'll talk about what that means, but an elevated vitamin D level, your risk is greatly reduced, and I'll show you some numbers to prove that. Vitamin D can lower viral replication, so you get into where you've got 100 patients and half of them have an appropriate vitamin D level. They might not show any symptoms at all, even though they're infected. It's because the virus isn't spreading. If the virus isn't spreading and multiplying in their body, their symptoms are, virtually zero. So that's where you start seeing this, well, how come this patient, even in the same family, is terribly sick, and the spouse isn't, and so on and so forth. Part of that's contributed actually to vitamin D. We can prove that now. Vitamin D can lower pro-inflammatory cytokines. So this is the big thing too with the COVID-19, is that this release, you hear about the cytokine storm, and you just get perfusion of the lungs. They just fill up with fluid essentially, and you're screwed, right? You go on the ventilator, and good luck getting off of that thing. So we know that vitamin D can lower, I think it's IL-2, I can't think of it, tumor necrosis factor alpha, but the names aren't important. The point is that those inflammatory cytokines are lessened by the vitamin D that we take. So the number that we should leave with tonight in our minds is when we go to the doctor tomorrow or next week or what have you, it's very simple to get a vitamin D blood drawn. Make sure that number's above 40. So all the data, all the good data in my opinion, point to 40 or above. If I had to put an upper limit to normal on that, I'd say 40 to 60. When you look at the old information, a vitamin D level of 20 was considered fine. Now we're knowing that vitamin D levels of 20, 25. I had a patient a couple of months ago that had a vitamin D level of 13 come into the store. It's way too low. So make sure that you're above 40 for that level.
Not every day?
Well, that's your blood level. So I'll get to dosing, like every day what you should be taking. But
well, this is blood work.
But blood
That's
work.
What your numbers
yeah.
supposed to be. Oh,
yeah.
okay.
Yeah. Your blood level should be 40. So, and everyone's going to need a different dose depending on all kinds of circumstances. We'll get to in a minute too. So COVID infections, again, they're not new. So, I mean, there's all kinds of data out there, but so 2002, the SARS virus, your severe acute respiratory syndrome came about. 10 years later, we had the Middle East, or the MERS virus. Again, it's an acute respiratory infection caused by this influenza virus that causes the cytokine storm, which basically leads you into acute pneumonia because your lungs fill up with fluid and you can't breathe. But again, this virus is just a little bit more gnarly, right? We all know that. So direct cause is by pneumonia, basically your lungs filling up and you can't exchange oxygen anymore. According to the CDC, between 2010 and 2019, an estimated 23 to 61,000 deaths have occurred, again, from the influenza virus that started the cytokine storm, which then ends up leading that patient into pneumonia. So bacterial pneumonia, essentially, where, again, fluid and material is just building up in the patient's lungs.
Question.
Oh, yep.
Is that per year?
This was per that whole time.
Wow.
So there's still, I mean, we don't know, like, right, all the data on this. I mean, that's a big range, a big net that they just cast out. Is it 23,000 people that died during that 9-year period, or was it 61? I mean, right, there's all, we don't exactly know, so.
Just a question, because
Yep.
I've had a pneumonia vaccine a couple times,
Mm-hmm.
and...
It only protects, right, and the pneumonia vaccine only protects against certain strains of pneumonia as well, too, like
Yeah.
Pneumovax 23, that's, there's all different strains, so that's where we're going to come into trouble with COVID-19, as we all can predict. Every year you get a flu shot, there's typically 3 different strains in that flu shot, and they're just making the best prediction on what those mutations and what those strains are going to be, and the same thing's going to happen with the COVID vaccine. I mean, now we've got COVID-19, but there's going to be, right, it's going to mutate. It probably already has. There's going to be COVID 20, 21, whatever numbers they want to give it. And we're always going to have to start playing catch up on what the virus, what that mutation is going to look like.
a couple things. Let's see. What are other causes of pneumonia?
Bacterial. So there's viruses
Okay,
and bacteria.
So those two.
Yeah, yeah. So you could get pneumonia just from bacteria.
Okay.
Yeah.
And what was I just, boy, did I just space that out? I don't know.
Well, think of, yeah. Come back to it.
Maybe.
So.
Yep.
So mechanism of action. So why is vitamin D so beneficial? And actually I like calling it hormone D because vitamins are basically chewed up, used up in some kind of like Krebs cycle or some kind of chemical process in the body, and then they're burnt up, like vitamin C. You've got to take vitamin C every day. You've got to take your B vitamins and so forth. Either take them through supplements or get them through your food. And they're used in some kind of chemical end process to get something else done. Vitamin D is not like that at all. So vitamin D turns on genes. It has a receptor on our DNA to then transcribe other proteins or send other messages, throughout the entire body to do something else. So that's what a hormone does. It docks onto a receptor on the cell. It goes in and it passes along information to improve something or turn something on or turn something off and that other thing. So I keep calling, after this slide, I keep calling it hormone D, so don't get confused. I'm talking about the same thing. But it's important to understand that this is not a vitamin really by definition. So too bad we ended up calling it a vitamin to begin with, but it's really not. So we got UVB light that hits our skin, and I screwed this up, but you've got UVB sunlight plus your skin that converts a compound into hormone or vitamin D. Once you've got that component, that hormone D travels to your liver and it gets hydroxylated. And not all of this chemistry is terribly important, but the point is there's a lot of processes involved. It's not like taking vitamin C or B12. There's a lot that needs to go on in your body even after you take the supplement. All these other things have to be in place for this stuff to work. So if you have somebody with cirrhosis or some type of liver damage, that's a person that, in my opinion, that's going to need to probably take more vitamin D because then they can't hydroxylate their vitamin D or their hormone D as well. So, all right, so you've got hormone D, you've got the liver, now it's hydroxylated. Not that that's terribly important, but it has to go through that process. Then it's got to travel to the kidneys or possibly the lungs. What we're finding out is, I'm going to go back and forth here, but vitamin D has to go to the kidneys, again, or the lungs, some other organ or tissue, and it has to get hydroxylated a second time. So it has to go through those two processes in order for it to now be in its final format to work in your body. So the receptor on our DNA, on our cells, for vitamin D is of the 125. It's hydroxylated by the liver and then by the kidneys or some other tissue. And once it has those two hydroxyl groups on it, now it's calcitriol by name, and now that's the stuff that's doing all the work in our body. So, like if somebody has a kidney transplant or only has one kidney or has poor kidney function, they're going to need a much larger dose potentially, to get to that 40. So we can start thinking of populations already that, okay, do I fit into that group? Is there some issues with my livers or my kidney or even my lung tissue? Do I have COPD? Do I have asthma? That is going to require me to now take more vitamin D.
Is there a way to test the amount of calcitriol in your body to see?
Well, when you're doing a vitamin D3 test, that's what it is testing. Now there's vitamin D2 tests. So so you want to be specific on the test that you're asking for. You want to ask, that's a great point, you want to ask for the vitamin D3 blood test. And that's the one that's going to be measuring the hydroxylated form.
Okay.
Yep.
Oh, vitamin.
Yep. And we probably all know this is probably a review for most of us. So why do we take vitamin D in the first place? It's to enhance calcium absorption so we don't get osteoporosis. Essentially, that's us brainwashed in pharmacy school, right? Take vitamin D, it's going to increase calcium absorption. And that's great to a point, but we'll circle back to that in just a minute. Regulates muscle contractions. So when you look at muscle fibers, you actually need calcium to actually pull muscle fibers together. So that's important. And then the other part is it's enhancing our immune system. That's the big thing that we're here tonight going to be talking about. Is more of how is this actually working. So hormone D, okay, so there's mechanism of action for reducing viral infections. It really works by 3 different ways. Vitamin D improves physical barriers, so tight junctions, gap junctions, adherent junctions. So what does that mean? So essentially, like tight junctions, I think of in the stomach. So there's 2 cells next to each other called enterocytes, and they're 1 cell layer thick, and they line basically not our stomach, but our small intestine. And vitamin D can go in and actually physically close that barrier or that junction up and make it tighter. So the tighter that junction is in our GI tract, the less likely actually viruses and bacteria can pass through our GI tract. Gap junctions are again between cell to cell, and it's more for transferring information back and forth, different neurotransmitters, things to that nature. But again, it'll improve all of the barriers in basically all of our mucosal tissue. So in our mouths, in our GI tract, sinus passages, anywhere there's mucosal tissue in our body, on our body, vitamin D will actually improve that barrier function. It'll make it a stronger fortress. It'll improve cellular natural immunity, and then it also enhances adaptive immunity. So with cellular immunity, it's just making those white blood cells more robust. It's making them, these scavenger cells, these natural killer cells, these very non-specific white blood cells that just basically go out into our body, don't know what they're really fighting against. They're basically scanning the area, and something doesn't look right, they're going to pick it up and try to destroy it. So these macrophages, these very non-specific cells of our immune system are just better killing machines, destroying machines. The adaptive immune system, though, is a little more sophisticated. So it goes into something called T cells, T1 cells, T helper cells, and there's all these, like, I always think of them like as an army, and there's generals and different commanders and so forth. And so vitamin D is actually going in and upregulating the message saying, hey, we've got to produce more antibodies to kill this virus and so forth. So vitamin D is, again, we don't see this in vitamins. This is really messages that are getting put out throughout the whole immune system saying there's more that we need to do here. And so vitamin D can go in and up-regulate those messages. All right. So for cellular innate immunity, so this is immunity in our immune system that, again, that's non-specific is the way I would describe it. So it enhances through increased synthesis of proteins that directly kill viruses. So we can actually upregulate production of proteins that kill bacteria, viruses, and fungus. Works by weakening cell membranes. So at this point here, these proteins that are upregulated by vitamin D actually can go into the cell walls of the bacteria to basically break up that bacteria or that decrease in viral infections. So even though that is such a low dose, that's still the RDA recommended amounts. If you pick up a bottle of 400 IUs of vitamin D, it'll say 100%. There is even with that little bit, you still can see this innate cellular immunity be enhanced. So at the very least, go home and take 400 units of vitamin D. With the more on the innate immunity, so it reduces the cytokine release. So vitamin D can reduce pro-inflammatory Th1 cytokines. Well, here's where I talked about this earlier. TNF alpha and interferon gamma. So it's basically taking, again, these proteins that are causing all of this massive inflammation in the lungs and helping put out that fire. And then here's where, again, vitamin D is really showing, I think, its beauty, is that it's influencing gene expression. It's turning proteins on, turning proteins off. In this case, vitamin D is actually going in and upregulating glutathione production in our liver. So glutathione I always think of glutathione as a 10-to-1 from vitamin C. So if a patient comes in, they're like, oh, and I want some vitamin C to boost my immune system, I turn that around and go, well, why don't you take something that's 10 times stronger than vitamin C? It costs just the same amount. Okay, what is that? Well, it's glutathione. It's right over here. Let me show you. That's very impressive to me. That this, again, hormone D can upregulate gene expression to now turn on more production of glutathione in the liver. So what we know, we know that vitamin D works. So there was a study done, actually in Atlanta, Georgia. I'm going to skip. This is just the citation, but here's the results. So this was a study that took place over 3 years in Atlanta, Georgia, 2011 and 2014, on patients that were on ventilators due to influenza virus. And they did basically a randomized study, and they took different populations of patients and gave them different amounts of vitamin D. They had a control group, so one set of patients didn't get any vitamin D at all. Then they bolus dosed some patients with 250,000 units. I don't know if they spread that out over a week or time frame, or if they just gave it to them all at once. And then they took a third group of patients and gave them 50,000 units of vitamin D. Oh, I'm sorry, 500,000 units of vitamin D. That's a big number. But their hospital stays were statistically significantly shorter in duration. So if you didn't get any vitamin D when you went in there and you got on the ventilator, you were in the hospital for 36 days. Plus there's a standard deviation of 19 days. That was their control group, and they measured their vitamin D levels between 20 and 22. And then the patients that got the 250,000, they got their vitamin D level up to 45. And again, plus or minus 20, that's quite a big window there. Right? It'd be nice to see a little bit, not as much of a deviation. But anyways, so they only stayed in the hospital for 25 days. And then those that got that huge mega dose, 500,000 units of vitamin D3, they got their level up to 55, and they were only in the hospital for 18 days. So I'd rather only be in the hospital for 18 days on a ventilator rather than over a month or longer, not getting out by just one thing. Give me 500,000 units of vitamin D. All they changed, all three of those groups, everything else was the same care. And the only thing that was different was the D3.
And was this like a one-time bolus, and then?
I don't know if it was a bolus or if it was spread out over.
Okay.
Maybe they gave them 100,000 units every day until they reached the dose. But that's impressive to me, that just by one single change that we can get a lot of these hospitalizations down.
Was there any mention of that, like with this COVID thing? I never heard anything.
I mean, there's some, I know of some hospitals and so forth and health networks that are doing vitamin D therapy to this extent. Hopefully, they are. But again,
Depends
there's.
on what insurance will pay.
Yeah, I mean, this is dirt cheap. I mean, you could honestly pick up a 50,000 unit dose, and this would cost you somebody $10 to do this treatment. It's super inexpensive.
Cheaper than a day in the hospital.
Yes, yeah. So, if you're interested in reading all the fine details of that study, again, that's the reference. I've got it printed out here. That's one study. There should be more. It'd be nice to have that study done. That was with the H1N1 virus. I think they typed the different influenza viruses that all these patients had, but they should repeat that study with COVID-19 patients and see if we can get the same results.
It would also be interesting, this whole kind of post-ICU, post-ventilator syndrome. It would be interesting to see if it affected that.
Yeah, definitely. I would love to see that. Yeah. So recommendations. So how do we get there? So they have looked at different bolus dosing, and is it better to give 50,000 units, for 3 days, or is it better to do 10,000 units for 15 days? It's actually better to give a smaller amount of vitamin D over a longer period of time. So Take vitamin D3 to raise your blood level to at least 40 to 50. I might even correct myself here. I'd probably go as high as 60. When you do get, so again, this is, the reason this is so important, it's kind of like with all the hormones that we deal with here, with progesterone and estrogen and testosterone, we compound so many hormones here. It is a story of Goldilocks. I don't want you getting... All right. Thank you for watching tonight's seminar. I hope you learned a few things about vitamin D. Our next seminar is at 6:30 here in Brookfield on July 16th. Our topic is going to be omega-3 fatty acid testing. I did have a previous video posted on YouTube on omega-3 fatty acid testing, but we're going to have an in-house seminar again in about 2 weeks on the 16th of July, 6:30 here at the pharmacy. You do have to register for it. You can do that online. I'll put that in the show notes below, or you can call the pharmacy as well. As always, I encourage anyone out there that's using compounded medication to use a PCAB accredited compounding pharmacy. I am very proud to say we were the first pharmacy in Wisconsin back in 2009 to become accredited. So if you are using compounded medication, again, I'll talk about that in future videos as well. If there's any questions you have, what you liked, what you didn't like about today's seminar, please leave that in the comments below, and I'll sure to get to those as quickly as I can. Have a great night. Thank you.